I love getting together with my next guest. He's always got some fantastic insights, and if you haven't yet heard his podcast, I would definitely encourage you to do so. Hello and welcome to Healthcare IT Today, where we bring you the latest insights and interesting stories from the world of health IT. I'm Colin Hung, and I'm about to sit down with Joshua Liu. He's the CEO of Seamless MD. I'm going to get a chance to ask him what he's seeing in terms of trends, what he's seeing in terms of technologies, and what's got him excited about healthcare IT here in Canada, as well as in the US. Let's get to it. Josh, welcome to the program.
Thanks, Colin. I'm excited to see you again.
Yeah, it's exciting to see. You've done so much since the last time I saw you. You've got that great podcast that's going on. Your company, Seamless MD, is doing amazing. But for the benefit of the audience that doesn't know you, can you give us a quick overview of you and your company?
Yeah, Colin. So my name is Josh Liu. I'm one of the co-founders and the CEO of Seamless MD, and we provide a digital care journey platform that helps health systems digitize patient journeys with automated reminders, education, and symptom monitoring to help them lower readmissions, ED visits, and costs.
Now, Josh, you're killing it online. I love your social posts. You definitely got your finger on the pulse of what's going on in healthcare. So tell me, what are some of the trends that you're seeing out there in terms of technologies or challenges that the healthcare systems are facing?
So when I'm talking to CMIOs and CIOs lately, the biggest trend is around the adoption of ambient technology or AI scribes to reduce that administrative burden for clinicians.
So when you say ambient, you're talking about sitting right there in the doctor's office, talking to the patient, and then having it transcribe the note?
Totally. It's like the technology is invisible. We're not staring at screens anymore. We just speak to patients and everything's automatically put back into the EMR in documented format. I think what's neat is that it's been mostly happening in the US, but recently I'm hearing it actually get adopted in Canada. So Oracle's coming out very soon with their digital assistant. The Ottawa Hospital has been the first in Canada to adopt Nuance's DAX Copilot. Even in Ontario, the Ministry of Health is now funding pilots of Ambient in clinics. So a lot happening across North America.
And is this surprising for you, or is this kind of like, no, this is like, you expected this to happen?
I expected Canada may have taken a little bit longer.
Okay.
I think it's amazing that it's happening cross-border so quickly. What I am hearing behind the scenes, though, is that even though folks are excited to try Ambient, adoption among clinicians is mixed. So Kaiser actually came out with a paper a few months ago where they plateaued at 38% of clinicians adopting Ambient. Maybe it's better now, but I think it's clear that it's not for every clinician, but it's helping quite a few.
We have heard some news stories about how much it does save in terms of the notes and the pajama time, as we just heard here, where they don't have to go in and retype some of the notes. But you're right, I don't think it's for everyone, and I think some people are still not so happy with the 90+% accuracy. I think they're waiting for the 99. Hopefully we'll get there. But it is kind of interesting to hear you say that Canadians are finally adopting it, and adopting it a little bit earlier than you thought. We are known as a country that takes a little bit more of a time, let's say, to adopt new tech. So I'm glad that the Ottawa Hospital and others are kind of jumping on the board right now. What, other than AI, is there anything else that you're hearing about or seeing that you're excited about?
Yeah, I think the other thing, and this is me being biased, but I think we're seeing device-based remote monitoring transition to more of I call it deviceless remote monitoring, where you can actually provide digital care to not just, the 5% of patients with heart failure and COPD, but with a software-focused approach, you can actually get remote patient monitoring to surgery, oncology, palliative. That's what we really focus on, and we're seeing that adoption grow quite really high the last couple of years now.
Is that a result of any external force, or is it just people recognizing that this is finally a need?
Yeah, I think folks have realized that they have to look beyond remote monitoring as a traditional device-based thing. Almost every patient has their own device. Maybe it's a smartphone, a tablet, maybe it's just a desktop browser. But then also these patients are now consumers who are expecting digital. And so I think providers will realize that if they want to reach every patient, they have to actually provide more access in different ways. And why not use the patient's device to do that?
Amazing. Josh, where can people go to find out more information about Seamless MD?
www.seamless.md.
Awesome. Thank you so much for being on the program, Josh. It's been great.
Thanks, Colin, for having me as always.
Hey, I want to thank Joshua for coming on camera with me and giving me his opinion on the technologies and trends that are shaping health IT right now. I always appreciate his insights. And if you have not yet heard his podcast, go down in the descriptions here on the YouTube and you get a link to it. Definitely encourage you to check it out. And hey, if you enjoyed this interview as much as I did, please like and subscribe. Also, head on over to healthcareittoday.com where you can find more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next video.